Okay, I'm going to tell you something so ironic, but there is an important lesson in it too. So you know how some lawmakers just worked really hard to slash funding for Medicaid? Well, it turns out that while they're doing that, the Medicaid program just keeps getting more popular. According to a poll published just this week, 83% of Americans now have a favorable view of Medicaid, and that's up from 77% in January. So what's going on? Well, Medicaid has always been generally popular, but until recently, most people who weren't using it weren't really giving it much thought. Then along came Donald Trump's budget bill, which, as we all know, is going to cut $800 billion of funding from Medicaid. 11 million people will lose their healthcare coverage as a result. Now, I guess maybe because they may lose it, Americans are starting to ask a lot more questions about what Medicaid does. And it turns out that the more they know, the more they love it. They're finding out, for example, that Medicaid is providing comprehensive coverage of health and long-term care to 83 million low-income people in the United States. That's a lot of people. It accounts for a fifth of healthcare spending in the country. I looked up one district close to me just for an example. It's CA22, that's David Valadio's. 530,000 people in that district rely on Medicaid. Medicaid is the largest payer for long-term care in the United States. Medicaid funds care for over 15 million people with disabilities. That's children and adults. It pays for services for people with physical, developmental, and mental health conditions, often when there are no other affordable options. Nearly half of all children in the United States get their health coverage through Medicaid. That's about 37 million children. Medicaid pays for 4 in 10 births. It's the largest single payer of maternity care in the country. Here's another really important one. Medicaid keeps rural hospitals open, especially in areas where there are few or no other alternatives. Experts are warning that these cuts could force over 300 rural health providers to close their doors. And finally, millions of working Americans rely on Medicaid because their jobs don't offer healthcare coverage. Private insurance premiums, they're just unaffordable for so many. Do you see what I mean? Once you've heard those things, don't you like Medicaid even more than you did before? I know I do. So please spread the word about what Medicaid does and who it helps. Because when it comes to healthcare, absence shouldn't have to make the heart grow fonder, especially when just getting informed can do the same thing.